Thank you all so much for making time to join us today. And really, this is going to be helpful information for you all as you're really implementing new strategies in your community. And so I'm going to waste no further time. I'm going to introduce Dr. Morgan McDonald, who is a familiar face and a very dear friend to TCCN. She's the Deputy Commissioner for Population Health in the Tennessee Department of Health. So Morgan, thank you. Take it away.
Mary, thank you. And I'll go ahead and share screen there. It's good to see just a lot of friends on the phone and faces. And I know you guys are enduring quite a lot and have been for the last 10 months. And so just want to, I'll say it over and over again. Thank you for your partnership and the personal and professional sacrifices that you all are making and how you're really standing in the gap for disadvantaged communities, and your advocacy is tremendously appreciated, as are just your ongoing efforts, and lots of prayers going back and forth between between us and you all on the phone. So thank you. I appreciate the invitation for Mary in giving some vaccination updates. There are a few slides that I'm going to run through, many of them pretty fast, because it's hopefully information that's somewhat familiar to you. I just want to make sure that we've got time to discuss just your experiences and any feedback that you've got, and then can certainly kind of lay some philosophical groundwork as to how we're approaching the day-to-day challenges and decisions that we've got to make from a vaccine distribution perspective. And I think, you know, if I can start with a disclaimer, it's that everything is draft and everything changes incredibly quickly. And so even thinking back to conversations that I've had with folks over the last couple of days, and then we get new information, have to make different decisions. And so I appreciate really the grace of a lot of people that are on the phone, and I know you guys are needing information quickly, and then the second you hear it, it changes. And so thanks for your understanding in that, because I know that's not easy to deal with as well. So with that, I will tell you what I know right now, and hopefully it won't be outdated by the time I'm done talking. All right. So I'm having trouble moving through my slides. Hold on one second. There we go. Okay, just to start with a general overview, and this information is on our website and has been distributed pretty broadly from the FDA. I know you all are already thinking about the end game in mind, and that is really what is our uptake going to be in communities, and particularly vulnerable communities, and trying to do our due diligence in really talking about the safety of the vaccines that are on the market right now. Well, not on the market, but being distributed right now. And I think one thing that I keep coming back to is that no safety has been compromised in the vaccines that have gone through the FDA process and received EUA authorization. Obviously, we have 2 vaccines that are on the market now. They've all gone through phase 3 trials. There have been, before approval, in that phase 3 trial, over 30 and 40,000 individuals in both Moderna and Pfizer vaccination trials. And I think something that has been helpful for me in understanding the process from an FDA perspective is that, you know, when research started, manufacturing started at the same time. And so what we have seen has really been unprecedented manufacturing and investment in manufacturing that usually takes years to accomplish, and because of the amount of investment up front in making vaccine that we didn't know whether that was going to work or not, then once we found the vaccines that do work, the manufacturing has already taken place and has caught up to that. And so that's been the real time saver from a time frame perspective. And I think it's just really important for people to understand that no corners were cut in this process from a safety perspective. And so we have already obviously gone through phase 1 through 3 of clinical trials, emergency use authorization, ACIP recommendations, which really establishes any contraindications or special population considerations and prioritization considerations. And we've taken all of that into account, certainly in our phasing and our distribution as we have implemented that across the state. And then obviously, as all of this is happening, there's continuous monitoring and surveillance. There are kind of the usual vaccination safety reporting mechanisms through VAERS, but also individual vSafe potential for people to enroll online to give a day-by-day report out of their symptoms or lack of symptoms, their experience after receiving a vaccine. Right now, you all are very much aware that we've got 2 vaccines on the market, Pfizer and Moderna. We expect that 4 more vaccines will receive FDA authorization in 2021, and so that is really good news. We don't know final data on efficacy of that, which may present additional really ethical and allocation kind of decisions that need to be made. But we are optimistic that there will be more that are coming on the market. Certainly a challenge as we're thinking about vaccine administration is that 5 of the 6 vaccines that are in the front running, 2 that are currently on the market, obviously, do require 2 doses from the same manufacturer. And so just the tracking of that and appointment making and how you keep track of that gets more and more complex as there are different vaccines that are on the market. And kind of back to that safety messaging, no significant safety concerns during clinical trials. Certainly some common side effects, headache, tiredness, redness and soreness, fever in about 15% of patients that received the Moderna vaccine, which seems to be actually more than Pfizer. And then these symptoms typically go away in a few days. There are the reports of anaphylactic reactions that have been extremely rare. There are protocols in place for additional monitoring of patients that have a history of anaphylaxis. In our health, among our health department patients, we've actually seen no anaphylaxis. We've seen some delayed reactions, but of the vaccines that we've given, which has been a significant proportion of the state, we have been very pleased about the lack of anaphylactic reactions. So that's helpful. And then, I think there's a lot of buzz around really myths of, is this vaccine going to give me a chip? Is it going to change my DNA? And the answer is no and no. And trying to combat that misinformation that certainly can get spread with unfortunate speed. Some of the things that we're using to really explain how this vaccine works is really using the analogy to a recipe. That's what an mRNA is. And it tells the body how to make that spike protein so that when it starts seeing the virus, it knows how to destroy the virus. And so I think that recipe analogy has been helpful. And it doesn't get incorporated into the cell's DNA. This is really just how the cell makes proteins. So just if that can be helpful, we've got some social media around that as well. One thing that I think is incredibly important, and we can't say enough, is our approach to health equity in the development of the frame of our phasing and our distribution plan. And it's been helpful to get direct feedback, of course, as we developed the phasing. I'd gone through kind of that process of developing the phasing, but then also in these kind of opportunities of, as you're looking at the plan, as you're hearing from communities, making sure that as much as we have planned for this to be equitable and to be really on the front end, overcoming both your staff barriers and your patient barriers, that the execution of that is as we would hope for it to be. So just please continue to keep that and that communication open with us. And as you have concerns, I want to hear them directly. Obviously, Mary's been a great resource in getting them back to the department as well. And then if you all are not part of our minority health stakeholder group that's on every other Thursday afternoon, that's an opportunity to give feedback as well. And I'll note that our distribution plan in particular has been highlighted through several national public health and media outlets because of the equity work that we've done. A lot of that comes into play with distribution and giving really higher allocation to counties and to areas who have a higher social vulnerability index, knowing that those residents tend to have an unfair burden of even just infection with COVID-19, and making sure that we are on the front end getting distribution to those counties, even when supply is extremely limited. And so, that does lead to some down the road, as counties are moving from phase to phase, and at different paces. Some of that is because some of those counties have been given a higher proportion of vaccine because they have a higher social vulnerability index. And so we're trying not to undo that equity work by redistributing vaccine other places or by people outside of that area, kind of rushing to areas with additional vaccine. So just a little bit of a framework from that perspective. You can find the vaccination plan and really all of the information I'm sharing on our website. There is a ton of information on our website. So if you click on the yellow bar on the top, that takes you to COVID-19, then you can click on the little box that takes you to vaccine information. The vaccination plan is there. The data that I'm going to show you is there, just in case you want to follow that a little bit more closely. And I'll note that we've got a regularly meeting vaccine stakeholder group who we have talked with quite a lot. Obviously, there are multiple sectors that are represented on this stakeholder group. They've been very helpful as we've been talking through the phasing and thinking about things like critical infrastructure and as well as age-based criteria and as well as they are thinking about how the phases are happening, also thinking about mobilization of resources as we approach each phase. So it's been a very helpful group. Obviously, individual communications have also been really helpful. So this is really kind of the bulk of a lot of our discussion right now in our vaccine allocation phases. And I think all of you all, it's starting to roll off your tongues too, what we mean by 1A1, 1A2, and then 1B populations. This phasing, as I mentioned, was based off of thinking about both risk and exposure and that greater social vulnerability. And so those three elements are highly at play and trying to balance that as we move through the phases that are particularly important right now with extremely limited availability of vaccine. And so I'll show you a map in a minute of where each county is in the phasing, but certainly we are rapidly getting through that. Well, I won't say rapidly, we are getting through 1A1 priority populations, and that did start at the end of December, and we expect that will largely be wrapped up, at least first doses at the end of January. These are our inpatient and other high exposure healthcare workers, residents of long-term care facilities, and staff of long-term care facilities, and then those over 18 unable to live independently, and our first responders. That has obviously, because that frontline staff was in 1A1, that was why first vaccine shipments went to hospitals to vaccinate their staff. Those first doses went to long-term care facilities, and I'll talk about that mechanism in a minute. And then most counties now are in 1A2, which is where you all as healthcare providers fall. And funeral and mortuary workers are there as well. And then we simultaneously implemented age-based criteria, which is about 400,000 people in the state, so that's 75 and up, and has been it's certainly a challenge in making sure that there's scheduling access and both telephonic and multiple languages and on our website. It's been pretty Herculean efforts to get all the county websites onto one website that we have now. And really our limiting factor is the amount of vaccine that we have, which is still extremely small. And so we are really trying to, again, create access, particularly for those elderly populations, both those that are in long-term care and assisted living, as well as those that are community dwelling. And that is really because 50% of our hospitalizations and 70% of our deaths are in individuals over age 70. And so it is a high priority to really make sure that we are doing great outreach to that that community of individuals. And I'll talk about some of the ways that we're doing that in the next couple of slides. Obviously, we have got challenges, absolutely, with the amount of vaccine that we as a state have been given, which is proportionally small to what we could be getting in arms right now. And then, of course, the vaccines themselves pose some challenges. The Pfizer vaccine storage at -70 degrees. The packaging is large, so in order to get a box of Pfizer, you have to be able to deliver 1,000 doses very quickly. And then, of course, we only get 41 boxes a week, and that it has had to be allocated in different ways depending on that phasing previously. Moderna, much lower, much less challenging from a storage perspective, and then dosaging is smaller as well, and we're getting the number of boxes that we're getting is larger, but obviously the amount of vaccine is not that much larger. But just to kind of put it in context, we've got 2,000 sites that would like to vaccinate now. Have got 354 that are onboarded to have vaccine. That includes our hospitals and long-term care sites. And we've got only 111 boxes of vaccine. So that is absolutely our pinch point right now is vaccine availability. We have, as of yesterday, I think, received almost 550,000 doses in the state of Tennessee. And I will note that 404,000 are in arms already, which is something that is absolutely to be applauded. And the providers that have gotten this vaccine and health departments largely have just, as soon as they've gotten it, it's been in arms and largely in the phasing that we've talked about previously, which is a pretty significant accomplishment. Accounts for almost 3% of the U.S. vaccination, and then about 1.3 times what would be expected based on population. Our delivery to long-term care facilities, and again, I talked about the mortality impact and why that is prioritized. It is done through a federal partnership with Walgreens and CVS, and so it does come out of our state allocation. 27,000 doses of vaccine have been siphoned off the top. And so, that quarter that hasn't been given, some of that is accounted for with this partnership that does go to Walgreens CVS and is managed by the feds. About 65,000 has gone to skilled nursing facilities, 62,000 to assisted living and others. We started with the skilled nursing facilities first, and then moving to assisted living. Those that are not within the federal or within the Walgreens CVS partnership are independent pharmacies. That's a pretty small number, actually. And they began vaccinating end of December and are making good progress in getting those doses quickly to skilled nursing facilities first. Our kind of skim off the top going to long-term care facilities is going to continue for the next couple of weeks until we have all of that population vaccinated. So probably through the end of January, which means that following January, there will be opportunity for more vaccine to go to counties because we won't have that allocation going immediately to long-term care facilities. So we expect that will help some with supply. Similarly, and I'll just note, because I know we're going to get questions around this, yesterday HHS announced that what they have been holding back from a federal perspective for the second doses, they are no longer going to hold back. And they're going to send that, we think, in the next few weeks to the state. We really have to look at to what degree do we really have confidence in production ongoing for those second doses versus what we're going to be able to release as first doses. And so we're really weighing, kind of, it's an analogy to cash on hand, perspective, and how much are we going to need to, as a state, hold back versus put into first doses. So more to come on that, but just know that we are really in discussions with manufacturers and otherwise in order to make good decisions around that. So it may result in more vaccine out in communities, but it's kind of a wait and see right now. So some tools for you if you're not automatically or already familiar with these. Obviously, we launched a Determine Your Phase tool that's a pretty easy, you plug in your age, any risk factors that you have, your occupation into this Find Your Face tool, your county of residence. And then it actually will automatically enroll you in a county that will, according to your county, that will then notify you of when your county hits that phase. And then similarly, we have a map now on our website that shows which phases the counties are in. And again, that's kind of color coded. Everybody is at least in 1A2. Shelby and Davidson County are still saying they're in 1A1. They are, though, reaching out directly to partner particularly with our safety net providers that are in 1A2. And so they're edging into 1A2 and vaccinating 75 plus. This map is a little bit behind, but officially this is where the counties are now. And obviously those are our two largest counties and have absolutely a share of disproportionately affected communities. You all are very involved in those two counties. And we're working very closely with those counties, both with hospitals that have been given vaccine to be able to vaccinate 75 and up, as well as counties themselves, and being able to widen that amount of vaccine that's available. And I'll say that those two counties also have very large hospital systems, and long-term care facilities. And so it's just taken them longer to get through 1A1, which, does have a regional impact, knowing that most of the hospitalizations that happen in that region, the higher levels of care are in those urban centers. And so there is still a regional benefit to those counties absolutely getting through 1A1 before they move through the additional phases. Another resource that I think that you'll probably find helpful when you click on that Find Vaccine Information, this is what pops up, our dashboard of vaccinations that have been given by the state. And we, as I mentioned, are over 270,000. This vaccine dashboard gets updated on Tuesdays and Fridays, so twice a week. We're starting to show that green bar there is the number of second doses. So that will be, catching up with the first doses, which is good. And then we've got a breakdown by age, race, and gender on our website. And I'll note that those that are over age 70, that proportion of individuals is going up, which is what we want to see right now as we've been moving, adding 75 plus to the 1A1, 1A2 individuals. And so now, over a quarter of our population that has been vaccinated is over 70 years of age, which is good, as we are starting to, hopefully we'll see more quickly the impact on mortality and morbidity. And then I'll note that we have we are committed very much to racial and geographic equity, and recognize that part of that is absolutely getting data out around who, from a race and ethnicity perspective, has been vaccinated. We currently have a number that we're not comfortable with in that unknown category. So, 44% of individuals who've been vaccinated, we don't know their race and ethnicity. And that's honestly getting too much into the weeds. It's because of how the mass vaccination module is available to county health departments. We are fixing that. And so that number, that will improve. The unknowns will go down. That will help us really reach those goals of making sure that we have equity amongst those who have been offered vaccine and who are receiving vaccine. Obviously, a lot of work also going into messaging and who is the messenger, and making sure that we are transparent with potential side effects and the safety messages of vaccination, but delivering that in a way that is culturally appropriate. And so thank you to you and your partners that have been extremely helpful in getting those messages out, and again, continuing to get your input on that. So quite a lot of work that needs to be done there, and we're absolutely committed to that. And then nationally, this is my last slide before we kind of open things up for questions. We're in the top 10 states, and actually we were number 3, I think, yesterday, in percentage of vaccine that has gotten to the state that is in arms. And so just tremendously proud of that. And kudos to the planning team here, Dr. Fiskus and Dr. Peterson and the teams that have done so much work in onboarding and setting expectations, and to our health department staff that I think you're very well aware was working straight through the holidays without days off, to make sure that as soon as we got that vaccine, it was delivered appropriately. And so really cannot thank them enough for the personal sacrifices that they've put in from a timeliness perspective to make this happen. So in the meantime, we are washing hands often. We're staying 6 feet apart. We're still keeping our masks on. We have, the light is at the end of the tunnel, but we're just entering the tunnel really in some ways. So we've got a lot of, I think we really still have some of our largest struggles ahead over the next month, 2 months, in maintaining vigilance while we're vaccinating. And so again, thank you for your work in that, and keeping that messaging consistent. So this is our number 4, and you all know how to reach us regardless, but just those day-to-day questions of things that are coming up. And obviously I'm happy to help facilitate those questions as well. So that's my last slide. And Mary, I'm happy to open it up for questions, or if you have any to launch from the beginning.
Yeah, no, thank you. That was very helpful. And I love vaccines cause adults. That's wonderful. Hopefully that'll go viral. Do we have any questions?
This is Jenny Bartlett Prescott. Hi, everyone. Dr. McDonald, I'm at Church Health in Memphis. So as you mentioned, we're still trying to get out of phase 1A1. Yes. Curious, as like you said, we have large hospital systems here, so they've been very busy getting their frontline staff vaccinated. Curious what the state sees as being the hospital's role once they get their hospital frontline staff vaccinated. Will they continue to be a big role in providing vaccines, or will some of those vaccines shift to safety net providers or the health departments or other modalities for getting shots in arms?
So it will shift to more to county health departments and more to, and I should have mentioned kind of who is giving vaccine and kind of when. So definitely we'll have more going to county health departments, and we are also onboarding some community-based pharmacies right now. There's a public perception that because CVS and Walgreens are doing long-term care facilities, they have community access. They do not. They only have vaccine for long-term care facilities. We will be onboarding Walmart in February, which will create more community access. They will progress in phasing consistent with their counties. And we've worked very closely with them, and then any additional retail pharmacies that may come on board, which will probably be more March, but to make sure that there are no barriers from an insurance status. So that will be payer agnostic. We've worked with TennCare to make sure that there'll be no barriers from an access perspective. Similarly, there's a process in place for uninsured to be able to be vaccinated. And then, of course, they can, bill insurance for people that have insurance, but it will be open access for all people. So there'll be vaccine coming there from a community access perspective. The county health departments will continue to increase their allocations of vaccine. And then safety net providers will be onboarded, and that will be priority really after the pharmacies. And so knowing that there's kind of one onboarding for the pharmacies that creates, again, broad access, and then we will be prioritizing safety net providers. I can't give you an exact time frame of when that is, but certainly we recognize your roles in tremendous accessibility for the populations that we want to target as a state. And so I can't give you an exact timeline yet, but that's where we are. In hospitals, that is an evolving process. They, yes, largely will be seeing significantly less vaccine allocated to them as they've gotten through their frontline staff. Obviously, they do have patient populations that will need access as well. And so we're navigating that and exactly what the distributions will look like. But priority going to really community access at this point.
We have a question in the chat. Any projections on dates for adding community health centers to sites who can administer?
Yeah, it's probably going to be, I would imagine probably March, but don't hold me to that. Just because some of that, well, it's very much dependent again on supply. And so the waters are changing very quickly as to how much supply we're going to get. We think it's going to be increasing, but we don't know that for sure. I don't think it's going to be decreasing. You never know if there's a supply chain interruption, and then what is going to happen with these kind of second doses that were in reserve. So we're moving towards that in the spring, but I don't have an exact timeline yet.
I actually have a question that I had read earlier that
You're on mute, Mary.
somehow I keep getting muted. I wonder if that's a sign. Sorry.
Spacebar.
I thought I had read that the governor had set aside a certain number of vaccines when they first came in for sort of an emergency supply. Is that accurate?
So there was one box. It's amazing about how much media that one box of vaccination.
Oh, it's one box of vaccines.
What happened was essentially we had asked for a box to be stationed at our state health lab in case there was vaccine spoilage somewhere, kind of for backup. It just happened to be that got delivered a day or two before hospitals received it. And of course, that just flew up exponentially. So there's not a significant percentage of vaccine that the state is just sitting on by any means. That has been all distributed. We still have kind of that backup supply for really emergency use.
Yeah.
Very small.
Jessica Freetag wants to know, as a safety net provider, will we need to take any steps to receive vaccine when the time comes?
So there is on our website, if you want to be a vaccinator of patients, sign up here, and that walks you through the onboarding process. And so yes, if you want to be delivering vaccine to patients, and I should have included that in the slides, but it's in the same place. Click here for vaccine information, and then there's a tile for healthcare professionals, and that's where you click, and it takes you to that.
If there aren't any questions,
Mary, you're on mute again. But I do have another question.
I just unmuted. What happens? Okay.
I was trying to wait to allow space for other people. Morgan unmuted. Morgan asking. Go for it.
Morgan, thank you so much for all your work in this season on behalf of the state. And we're excited to see the vaccine roll out. I know there's been a lot of interest in Davidson County about the outlying counties and the availability of going to other counties to get your vaccination. You may have spoken to this. My arm's in a sling and I've had to move and adjust it and leave the room for a minute during your presentation. But can you speak to the ability of non-residents to get vaccinated if they're 75 and up, but want to go to Wilson County, for instance, or they don't live there?
Yeah, it's a delicate balance. We are not encouraging vaccine tourism, primarily because of the equity piece of what we've been talking about in particularly just disadvantaged communities and making sure that they're not flooded with people from halfway across the state for people coming in to get vaccination. And at the same time, the counties are not necessarily checking those driver's licenses or other forms of identification because there is often crossover effect and people live in one area and work in another. And so if they live or work in a county, yeah, they can go there to be vaccinated. Certainly understand the public desire to, my mom is 85 and I want to get her vaccinated, and that is happening to some degree, and at the same time we're really trying to get vaccine particularly to those urban counties, Shelby and Davidson, to make that as short-lived a problem as we can. So it's happening. We're not encouraging it. And we're kind of doing the best we can to get as many people. At the end of the day, we want as many people who are at risk to be vaccinated. So.
Dr. McDonald, I was going to ask, do you anticipate any changes in our in the vaccine rollout strategy for the state based on the announcement from HHS yesterday? Every day feels like it's 10 days, right? I'm like, that's just yesterday, right? Yesterday, obviously reinforcing 65 and up, and then anyone with health conditions. I know we've already seen calls coming in asking for letters to prove that they have certain diagnoses so they can be eligible for vaccines. And I mean, we're still in 1A1, so I can imagine what it would be like once we start having vaccinations for people with just general health conditions. Are there any thoughts about how that may impact us in Tennessee?
Meaning the release of the second dose?
The release of the second dose, and then it was like expanding the phases to include 65 and up and anyone with a health problem.
Right. So we aren't going to do that immediately because we don't have doses on hand immediately to do that.
Right.
And so we definitely have gotten a lot of questions. The Fed said it's going to 65 and up, and you haven't changed it on your website yet. And we aren't going to do that until we have vaccine in hand. As I mentioned, the population that's 75 and up is 400,000 in the state. The population that's 65 and up is 1.6 million. And so we don't have doses on hand to do that. We expect that we likely won't have those doses on hand for a couple of weeks widely. In some of the rural counties that have smaller populations, they may move to 70 and up and may move to 65 and up. I think it's going to take a while a while being a couple of weeks probably for us to get to 65 and up more broadly. And again, that's going to depend entirely on supply. And we don't know, although the Fed said it's coming immediately, that really means 2 weeks to them. So it's a little premature to be able to know exactly how much we're going to be able to pace our supply. I do think there'll be more availability, but the degree to which, and then being able to put that into practice in the phasing piece, probably another week or so before we know that for sure.
Other questions for Dr. McDonald?
Hi, I've added several questions to the chat box, please.
Gosh, I do not see your questions, Dr. Mack. Not that we haven't added. Could you ask your questions outright? I don't see them in the chat.
Absolutely, no problem.
Thank you.
Okay, so one question I just wanted to clarify. Once you have completed the eligibility survey and you've been assigned to a group, once you get notified that that group is being vaccinated, do you then just go onto your county website and request your appointment for vaccination?
Yes, that's the process. And it's a little bit, some of the counties, so particularly our metro counties are not yet onboarded on that system. So it's a little bit different county to county, but for the most part, most counties in the state are operating in that way. And we are moving towards a more streamlined process, onboarding an IT vendor to make that more consistent and a little more user-friendly over the next week or two.
Okay, all right. And then I had another question, please. So for the, they have, I've heard that there are extra doses that may be available, and you can sign up for, I guess, kind of, if you want to be considered for those extra doses, you have to sign up on a day-to-day basis. Are there multiple locations where you may be able to go to get those, to get vaccinated? If you have to be there within 30 minutes and you have to go across town, say for instance, in Davidson County, if you live across town, you may not be able to get to Lentz Public Health Center within 30 minutes. So are there multiple locations where you may be able to go to get those extra vaccinations?
So that's been a county by county decision, and actually Davidson is the one that made the big splash over the last couple of days. And their process, I'm not entirely familiar with what they're doing, but in essence, it's to keep from wasting vaccine at the end of the day. And so if there's a packet that's already open, you don't want that to go to waste. And so they had put in a sign up process that is pretty unique to Davidson from an online sign up, et cetera. So I don't know that I can speak to that or that it has broad applicability across the state. They're managing it as they're managing it.
Thank you so much.
Sure, sorry.
There's also a question about whether you could make these slides available to us.
Yes, that's fine. And I emailed them to you, and you're welcome to share that.
Wonderful.
Actually, I'm going to send you a revision. And
okay.
then
we'll use your second edition.
Sure.
Perfect. Perfect. Also, I'm curious from the audience to, you know, what your experiences have been, kind of what you're hearing, what you're seeing. I don't know. It's a little bit vague, but I was really hoping to hear from you all. And we do have, we have a reporter from Kaiser Health News who's very interested in sort of learning about the different experiences in the community, who's on the call as well. If anybody wants to share, the only thing I get is anecdotal right now, that some of our members have shared with me that they got their vaccines, you know, very smoothly and in a timely manner for their teams, for their providers. And I'm just kind of wondering, is that the experience most of you all are having?
I can speak from Memphis. I think it could be helpful for the state to specifically request hospitals to vaccinate safety net staff. I think, you know, it's a confusing time, and understanding whose lane is whose to do what. And as you said, Shelby County's huge, and our health department is certainly putting shots in arms, and have, you know, they use their supply every single week that they have it, but that could help. We know our safety net providers will be one of the first ones called upon to, even if it's before we get vaccines, to work in partnership with the health department, as we've done with testing, to maybe hold some special events. And we would love to get all of our frontline staff vaccinated, and we are not there yet. So that would be great.
Yeah, and we may, I think we've had some email communication about that. We did tell them from the very beginning that after they're, you know, as they're going through their 1A1 frontline staff, that we would expect that they would, if any leftover vaccine or otherwise, that they would prioritize 1A2, particularly the safety net and 75 plus. And so we actually put out another letter to them, actually at the request of Memphis hospitals last week, for additional kind of cover that they had asked for to do that. So we'll definitely keep pushing. But yes, you guys are our priority, and we want to make sure that's really obvious to everybody that has vaccine.
To echo a comment that Brian wrote in the chat, just from the Nashville perspective, we were very grateful to get a call from Dr. Wright at the health department locally the week after Christmas and to begin vaccinating our patient-facing staff. And it seemed like later that week, all of a sudden the floodgates opened, and a lot of pestering of Vanderbilt, St. Thomas, and HCA TriStar, you know, began to get through. And I think what happens is people want to underpromise and overdeliver, and when they have a bolus that becomes available, they suddenly made it available also, you know. And so we didn't end up having to tap into some of those resources then, but that's been our experience, is that the hospitals, you know, were playing their card safe, opened it up when it became available, and then there were little bursts. I don't know how that will play out in some of the more rural counties, though, and some advocacy from the state level to get certain hospital systems to take ownership would be a great asset.
Anybody else want to discuss what their experience is or what they're encountering in terms of community questions or feedback, anything that might be helpful? Got another question here. Oh, yeah, and Helen Scott says her hospital system vaccinated staff and frontline volunteers. I know in Knoxville, Interfaith also clinic got vaccinated, I think Christmas Eve. So I think so it sounds like it's just kind of catch as catch can, depending on your specific department or hospital and whether they have vaccine available to get to you.
Mary, it's Melissa from Interfaith.
Hey, Melissa?
And yes, the majority of our clinical staff did get a vaccination Christmas Eve. It was exciting, you know, to have that as a Christmas present. And then the remaining staff that could not get vaccine that day, it was kind of exactly as Morgan described. As a pocket opened up, this hospital called and we got 4 people in, and then this hospital called and we got 2 people in. So it's been those little bursts to get them covered. But we were very excited to get that telephone call Christmas Eve. Come on down, and we went on down.
That's wonderful.
Just out of curiosity, Melissa, what hospital system was that?
It actually was not a hospital system that day. It was the health department. And it was actually kind of a dual thing. Blount County Health Department helped out as well because they had some, I guess it would be kind of like that leftover that you were talking about going on in Davidson County. And we served so many from Blount County as well that they were willing to step up and help our staff.
That's excellent. The only reason I asked is because it has come up. We partner with Covenant Health, and so it has come up that maybe a Covenant Health hospital might be willing to vaccinate our frontline employees.
Yeah, I would say for Church Health, we were able to vaccinate because of a relationship and a residency in partnership with Baptist Hospital System here. But speaking on behalf of the other safety net clinics, which are all FQHCs, they're still seeking immunizations for their frontline staff. So yeah, I think it is relationship based, organization to organization, and a lot of those kind of the medical society here is actually centrally coordinating those what we call quick fill appointments, and they're helping prioritize our staff and our volunteers at our clinics just to make sure they're maybe at the top of the line without whoever the reporter is, please don't print that, but you know, just working behind the scenes to make sure our safety net providers are getting those spots as they become available. Dr. McDonald, I do have a question about future planning and wondering, with all of the providers who've signed up to become vaccination providers, where does the planning happen? I mean, we've even had conversations here in Memphis and Shelby County about trying to get a list of who in our county has registered with the health department so we can preemptively start mapping those locations and pulling everyone to the table and honestly divvying it up, you know, figuring out we know our main limiting factor is just vaccines, but once the vaccines come, how will we store them, deliver them, you know, and make sure that we're reaching, you know, the edges of our community that don't have the ability to use Sign Up Genius or Eventbrite, which is right now the only way general public are accessing vaccines. Does that get coordinated by the state, or is there any thought in how to do that as we prepare for March?
Yeah, so we are really asking the local health departments because they know the landscape to coordinate that local approach. Again, with making sure that access is equitable, that it is, you know, we're going the extra mile for the people that really need it the most. And so it should be coordinated through the local health department. If we need to have some conversations otherwise as to who and how and that kind of thing, happy to do that. And we want to make sure that we as a state are giving them the resources that they need to do that.
Okay.
So, and that question about who in the community has been onboarded, will be onboarded, is we're trying to get that information to our local vaccine coordinators who are in county health departments. I don't know that that is, I don't know that they have that yet, but it's in the works.
Okay.
Any other questions at this point? This has been so helpful. We'll probably need to continue having these conversations episodically, just because, as you said, everything's in draft and we're just learning as we go.
Morgan, I have one sort of down the road question. You know, I know you probably aren't fully, you're not confident of how this vaccine documentation will be used going forward, but I can imagine all kinds of scenarios where proof of vaccination in the coming months could be invaluable. Is there going to be a database where obviously people should make an extra copy of their vaccine card? I don't know if it needs to be notarized or anything like that, just in case, but is there a repository if somebody loses proof of vaccination in the event that they need to document that for some other purpose?
Yeah, great question. And so we are using our tennis registry, which is the vaccine registry, the same registry that we use for VFC, for example. And obviously keeping those vaccination records in tennis. And so that'll be automatically accessible. And every vaccinator that receives vaccine supply is required to enter that in tennis the same day. So, and that's where some of the difficulty has come in with the race ethnicity data, because that's where but I'm having to upgrade those modules. So, but it's all in the same place.
Great.
Still have time if somebody else has a question or a comment. All right, we'll give everybody 3 minutes back to their day. Thank you again, Dr. Morgan. We appreciate you so much.